No, I am not a smoker, but I do vape.
We are seeing heart attacks in the younger people.
We encounter some patients are between 35 to 45 years of age. So there is no single reason for this heart attack, sir.
What exactly is probably the reason for all this?
There are not much warning signs because whatever happens in the younger populations happens suddenly.
Correct. Is it also causing any sort of like a risk for heart disease directly or indirectly?
He came with complaints of headache and his blood pressure was very high. When I asked him the habits of smoking, vaping, no, I am not a smoker, but I do vape. Correct. So practically vaping and smoking is all same. It's the same risk factor for the development of cardiac disease. When was the last time you checked your blood pressure? Then he was saying maybe if somebody is facing work burnout or some stress during the works, that's a common occurrence nowadays because of the demanding work schedules and the lifestyle.
Exactly. At what age one should just go for and get your metabolic workup checked?
Anybody who is 40 or 40 plus should definitely check it.
Correct.
But nowadays, it's not like that nobody can get a heart attack. Anybody can get a heart attack.
Is it just a headline for media or is it actually happening? Namaste everyone. Welcome to yet another episode of podcast today. Today we are going to discuss a very interesting topic, a serious topic, raising eyebrows. Why are we seeing heart attacks at a younger age? We can see people in 30s or 40s getting heart attacks. Is it just a headline for media or is it actually happening? Is it anything to do with our diet or is it anything to do with the lifestyle? Today we are joined by a very special guest, Dr. Sandeep Golchha, who is a cardiologist practicing in Dubai. We are going to discuss with him what are the reasons, whether it is actually happening and what can be done to avoid that. Welcome Dr. Sandeep to today's podcast.
Thanks, sir.
Dr. Sandeep, can you tell us something about yourself?
Thanks for inviting me for this podcast. Myself, Dr. Sandeep Kulkarni. I did my cardiology training from GB Pant Hospital, New Delhi, India, and I am practicing as interventional cardiologist for last 10 years, in which last 6 years I am practicing in Dubai.
Thank you for your introduction. Now, Dr. Sandeep, let us directly get on to the point.
Yes, sir.
We are seeing heart attacks in the younger people. So, do you think it is just the headline in media or is it actual happening? Since you have been seeing these patients every day, you think it is actually happening?
Yes, sir. We can say that heart attacks are happening more and more commonly in younger population. Like in my clinical practice, I can say our majority of cardiac patients are between 35 to 45 years of age, or more commonly it's less than 50 years of age.
Interesting. Yes, it is actually happening. So what do you think? Like, is there a lifestyle which is playing a role, whether smoking, vaping, your work culture, sedentary style? What exactly is probably the reason for all this?
So there is no single reason for this heart attack, sir, but multiple reasons which are contributing to the heart attacks. So out of this, definitely smoking is very common risk factor.
Right.
Majority of patients which we encounter have a underlying risk factor of smoking. Other than that, lifestyle changes like sedentary lifestyle, patients mostly are diabetics, patients lipid profiles, cholesterol levels are very high, and they are following just a routine sedentary lifestyle with no space for the activity or active lifestyle. So this is definitely contributing towards the heart attacks or cardiac diseases.
Yeah. So thank you for sharing this. So viewers, please understand that these are the things which we already know: smoking, active lifestyle, healthy diet. So this is something which we should be really caring about. Otherwise, we are at a risk of developing some sort of heart disease in future. But these are some of the things which we already know. Are there any lesser known reasons or something which are not commonly known for common people but that is still causing some sort of heart disease, Dr. Sandeep?
So there are some lesser known factors because now we encounter some patients in which we are unable to find out the direct cause, like there is no smoking, patient is not a diabetic, he is otherwise lean, thin, not obese, his lipid levels are also not very high. But in these kind of patients also heart attacks are happening. One common thing generally going unnoticed might be the stress, which
Okay.
is underestimated, but it has to be, I think, investigated further for direct links to the heart attack.
I agree.
And I think family history, genetics is also a very important thing, which
Okay,
people
yeah.
generally don't pay much attention.
So stress and genetics. So these are something which are partially we can have a control on, but something like a genetic, it's very difficult to control. Stress, at least we can handle ourselves. We'll try to de-stress ourselves. Now, thank you, Dr. Sandeep, for sharing this information. Now, in younger generation nowadays, we are seeing almost everyone is becoming health conscious. They are like a gymaholic, what we can say, obsession to go to gym, taking supplements. Whether social media is contributing to that or peer pressure, we don't know. But do you think younger heart attacks in younger people, is there anything to do with it, or it's just a coincidence that more and more people are health conscious, but still we are getting heart attacks at younger people in younger age?
So we can say, sir, it's both of them, because nowadays people are more aware. They are reporting, they are shouting the medical health very commonly, very easily, and health risk screening factors and cardiac consultations and cardiologist's role is also there, because it's nowadays it's more commonly available if compared to the last 10 years back.
Correct.
So definitely more people are reporting, or more people are coming to the emergencies with the symptoms, so we can diagnose little more. But definitely the incidence is also increased because of the lifestyle which the current generation, or in the current developed world, which the lifestyle which we are following is also contributing towards the more incidence of the heart attacks.
Right. So as Dr. Sandeep correctly mentioned, it cannot be just a single reason that is causing all these issues. So you need to take care of so many issues which we are dealing with, unfortunately nowadays, and we need to take care of each and every factor, whether it is diet, whether it is lifestyle, whether it is excessive workout or less workout, all these things. So then coming to the next important questions which our young viewers want to know: are there any warning signs for a heart disease in these people, or something like the traditionally we see that chest pain or pain in the heart area, chest area, this is usually the commonly known symptom for heart disease. So but if we want to identify much before that, are there any warning sign for all these heart disease in younger people?
So I can say, sir, unfortunately for the younger population, heart diseases or heart attacks present suddenly. There are not much warning signs, because whatever happens in the younger populations happens suddenly.
Correct.
Because the heart attacks happens with some mild blockages, which suddenly becomes 100% because of variety of risk factors, inflammation, stress. And in younger population, underlying heart is healthy, but there is suddenly plaque ruptures which causes sudden occurrence of 100% blockages which present as a heart attack. So there might not be warning signs, but all the younger populations should screen themselves for the underlying risk factors that can help them to reduce the risk factors. Otherwise, there might not be the warning signs of exertional angina or chest pain for the younger population like in the elderly population, and they generally tend to present suddenly.
Yeah. So viewers, please understand that you may or may not encounter any warning signs. So then in that case, what should we do? Is there anything like a simple screening for these people, wherein especially someone who has, say, a family history of heart disease, or someone who feels that he is at a higher risk for heart disease? Is there anything like a simple screening which he can do with you as a cardiologist, so that at least we can identify if he is going to develop, or if he is at a higher risk for heart disease?
So for the younger population, screening of risk factors becomes very important to find out whether they are more prone to develop heart diseases or not.
Correct.
So in the screening, one is like they need to, if they are smoking, then they need to try to quit smoking.
Right.
They need to screen for the diabetes, because many of the patients which we encounter in our practice present as a heart attack, but they don't give any history of diabetes. First time only in our hospital we are detecting them as a diabetics.
Right.
Then they should screen for the cholesterol levels, like lipid profile, just to see if their bad cholesterol is high, so that risk can be mitigated by the medications. And other than that, if patient is not following an active lifestyle, if they're sedentary, then they can go for some other health checkups like doing a basic ECG, stress exercise test, which will tell us about that is there any significant cardiac disease present or not.
So please understand, if you have you yourself have a history of diabetes, hypertension or cholesterol, or if your family members have this history along with heart disease, better to go for a screening. That's the best way I would say to identify someone at a early stage. Now coming to the next question, Dr. Sandeep, nowadays everyone is stressed. So what is the role of stress in development of heart disease in younger population? Is it actually a factor, or again is it like just a hype all over the place? Yeah.
So as of now, there is no direct causation established to the stress and cardiac issues, but in our practice we encounter that stress plays a very significant role, because if somebody is stressed, then what happens? There is a lack of sleep, there is anxiety, then people tend to get sometimes this metabolic syndrome, little bit obese, it tends to development of the hypertension.
Correct.
So basically stress becomes an inflammatory process for the body, and all heart attacks basically happens because of the plaque rupture, and that is again an inflammatory process. So it needs to be further investigated for the direct linkage between the heart attack and stress, but clinically we feel that stress is also a underestimated but still a significant factor.
Yeah, so stress is definitely something which we should not be ignoring. But Dr. Sandeep, like a lot of younger people are there who complained of burnout because of the work schedule, the heavy work. So even this burnout, or say anxiety example, someone is very anxious, very stressed, burnt out. So is it like actually going to cause any heart disease, or they should still be trying to stay away from this risk factor by any way, so that the heart disease will be avoided?
So if somebody is facing work burnout or some stress during the works, that's a common occurrence nowadays because of the demanding work schedules and the lifestyle.
Exactly.
There is no direct link, but these persons should screen more for the underlying risk factors. If they have a smoking habits, or they have any underlying diabetes or cholesterol levels or high BP, which they should be regularly checking, because unless they measure the blood pressure, unless they do the blood test for the cholesterol and sugar, somebody is not going to tell them that you are diabetic. Unless you check it, it's not going to manifest by any symptoms.
Right.
Like for example, we can say yesterday only in my clinical practice I saw one patient. He came with complaints of headache and his blood pressure was very high. When I asked him, when was the last time you checked your blood pressure, then he was saying maybe 3 years, 4 years back. Correct. I checked his blood pressure. Correct. And blood pressure is like such a simple
it's
investigation,
very available. Yeah.
Anybody can check at home, at any clinic, any pharmacies.
Correct.
But still people don't check it.
So yeah, obviously so many stress related issues are there, burnouts are there. Those can cause high blood pressure, those can cause metabolic disease, which in turn can cause heart disease. So definitely I wouldn't say directly, but indirectly it can be related. So as Dr. Sandeep said, it is very easy to check, say, blood pressure or sugar or cholesterol. You visit the doctor and get it checked, so that at least if you are identified at early levels or early stages, it can be fixed. Now Dr. Sandeep, frequently we see younger people with long screen hours, not getting enough sleep, whether it is due to watching TV late night, or whether it is due to work or working on laptop. So is it also causing any sort of like a risk for heart disease directly or indirectly, or it doesn't matter whether sleep is not all that important, we can just focus on work?
So again, there is no direct relation to the heart attacks and this.
Right.
But nowadays more and more studies are coming. People are becoming more aware that lack of sleep is one of important factor, because eventually lack of sleep disturbs the body metabolism.
Correct.
And again, that tends to makes a patient vulnerable to develop like high blood pressure. Again, the metabolic disturbances like insulin resistance, which can lead to development of diabetes.
Right.
So these are the risk factors. So eventually the lack of sleep or stress, which is not directly related, but that can make a patient vulnerable for the precipitation of the risk factors, and these risk factors are eventually related to the development of heart diseases.
Yeah, so all these risk factor which we just discussed, whether it is inadequate sleep, long working hours, stress, anxiety, burnout, these may not directly be linked, but yes, these can cause so many metabolic disturbances in your blood and body that it can cause, or it can be a risk factor for development of heart disease. So Dr. Sandeep, coming to the original discussion which we had, that seeing heart disease or heart attacks in younger people, what advice or what suggestion you would give to these younger people so that the risk is minimized, even if there is a genetic risk or something which they cannot fix, but what advice would you give them through our discussion so that they will be at a lesser risk or minimum risk of development of heart attacks or heart disease in future?
So for the younger population, the most important is adopting a healthy lifestyle. They should indulge in a regular physical or cardio aerobics activities, at least minimum half an hour every day, minimum 5 days a week or almost all of the week.
Yeah.
They should not indulge in the habits of smoking, vaping, because practically smoking and vaping are same. Some people come to us, they say, no, I am not a smoker, but I do vape. Correct. So practically vaping and smoking is all same. It's the same risk factor for the development of cardiac disease. And then they should regularly screen for any presence of hypertension. It's a very common thing. They can check the blood pressure at home also, at clinics also. And once in a while, they should do some basic blood tests like checking for the blood sugar, checking for the cholesterol. And if that is normal, then maybe once in a year they can check. But if it is on the borderline range or somewhat on the higher range, then they need frequent checkups. And if it is definitely high, then they should consult the clinician to start the treatment for this.
So someone who does not have any say family history or genetic history for heart disease, at what age would you recommend them to check for sugars or cholesterol or blood pressure routinely? In what age, like, is there anything like a guideline, or from your day-to-day practice, like at what age one should just go for and get your metabolic workup checked so that their risk for the heart disease will be identified at earliest?
Maybe few years back, previously we used to say that anybody who is 40 or 40 plus should definitely check it.
Correct.
But nowadays, when we are encountering these ailments in persons who are less than 40, maybe 35, 36, 34.
Right.
So, and there is no specific guidelines which says that at this age this should be checked, because the guidelines are mainly Western guidelines.
Correct.
Every population is different, every demography is different.
Correct.
And depending upon the risk factors, depending upon the lifestyles, I think checking the blood pressure is a very common phenomena. Anybody who is more than 30 plus, he should check his blood pressure.
Correct.
And once a while, there is no harm in checking the blood glucose levels and lipid profile, basic labs, just to have an idea what is the underlying physiology going in the body.
Right.
And so that they can detect it at a very early age, say at the age of 30. And then they can be more cautious. They can take more precautions if anything abnormal is there.
So, very important message that we maybe 10-20 years before we were doing a screening in someone who is 40, mid 40s or late 40s or 50s. But the screening age probably is now preponed, and even in 30s we need to check. If you have a family history, definitely yes. If you have a genetic predisposition for heart disease, definitely you should be checking at a younger age and should not be waiting for 40s and 50s to screen for this. So the take home message is, it's just not a media hype. Is it that what you want to say, Dr. Sandeep, or actually you are seeing heart disease in younger people and everyone should be careful about?
Yes, sir. So in our clinical practice, as I mentioned, that more commonly we are seeing the patients who are between 35 to 45. So it's a reasonably very young population.
Yeah, it's
alarming. And so everybody should be aware about this. it's not like that nobody can get a heart attack. Anybody can get a heart attack. But yes, if somebody has a risk factors, then chances are more. And whenever you feel that something abnormal is there, or maybe you are feeling some chest heaviness, chest pain or something, don't ignore this. Please report to the hospital, get a basic investigation done. Maybe it might be a simple gastritis, but it's always safer to rule it out rather than suffering later.
Correct. So that brings us to the end of this interesting discussion about heart attacks in younger people. Viewers, please remember that this is not just a headline or media hype. We are actually seeing heart diseases or metabolic diseases at younger age. The reasons may be anything, whether this is genetic, whether it is your lifestyle, whether it is directly or indirectly stress, burnout, anxiety, inadequate sleep hours, longer screen hours. What we can do is we can follow a healthy lifestyle. That is most important. Healthy lifestyle does include a healthy diet, exercise. In addition, especially for younger in 30s or 40s, we should not shy away from screening for metabolic diseases, as Dr. Sandeep said, lipid profile or sugars or blood pressure checkup, so that all these diseases will be identified at early stage. The purpose of this podcast is to give more and more authentic information from the expert in that field. If you have any doubts or any questions, you can write it in the comments and we'll try to reply to those questions at earliest. If you want Dr. Sandeep to discuss any other topic related to heart or cardiology in future, definitely you can recommend this. You can like and subscribe and share this information with each and every person you feel should be knowing about heart disease. Thank you, Dr. Sandeep, for coming today and sharing this valuable information.
Thank you.
Thank you very much.